Now to a sobering milestone in Ohio tonight. 5,000 COVID-related deaths reported since the start of the pandemic. You may be wondering how we got here and what can be done to keep more Ohioans from dying. COVID-19 now one of the main causes of death in our state.
State leaders and health experts say we have the power to slow this virus down. 5 on Your Side investigator Joe Pakanakis joins us live and goes in depth on how we got here. Hey, Joe.
Courtney, Frank, local leading health experts say Ohio could have done a better job, and now is not the time to let up in this fight against this virus.
When you think about the 5,000 number, it does hit you. You think, wow, people are not surviving.
Summit County Health Commissioner Donna Skoda says growing family gatherings and COVID-19 protocol fatigue are playing a role in Ohio's death toll and a recent spike in cases.
If you invite your family over and you haven't seen them for a long time, you start to let your guard down.
Children going back to school hasn't been as much of a factor as predicted.
But we have seen a lot of cases related to the groups of people coming together around school co-curricular activities.
And Skoda says Ohio's COVID-19 death total is also due to the state having a tough time getting protections in place when the virus really picked up steam in March.
First, we didn't have test kits. Then we didn't have testing. Now we thought we had some testing. Then the labs got backed up.
In a lot of ways, it seems like we failed.
Dr. Amy Edwards with University Hospitals says Ohio could have done a better job, even though the state now ranks 27th out of 50 states with 43 deaths per 100,000 residents.
We either didn't get the message out clearly enough or fast enough, or we didn't work hard enough, or people didn't take us seriously enough.
Dr. Edwards says mixed messages from the federal and state government concerning the severity of the disease also played a role.
It's all about messaging. So to me, that's the consistent thing. If you look at the countries that are doing well, it's the countries that follow the science. If you look at the countries that are not doing well, it's the countries that didn't follow the science. It's very easy.
Dr. Edwards still urging people not to have those large family gatherings. If you're going to have someone over to your home, make sure they're wearing the mask and keep 6 feet apart.
Great advice, Joe. And we see the spike right now in COVID-19 cases. The big question, should we be worried?
Well, the Ohio Department of Health, Frank, reporting just today 1,430 new cases. That marks only the 13th time Ohio has been over that 1,400 case per day threshold. Just last week, Governor DeWine saying the increase in cases and hospitalizations are very concerning.